I'm Karishma Gupta, and I'm a urologist. I grew up in Cleveland, Ohio, and I trained at Case Western Reserve University. I've been in Cleveland for most of my life, and I'm very excited to move here to Alabama to continue my practice. My husband's from Alabama, so I'm very excited to build a community here with him, kind of like the one that we've had in Cleveland, Ohio for most of our lives together. I actually stumbled upon urology by chance. I met a few urologists during my OBGYN rotation when we consulted them for a bladder injury. And at the time, I was already interested in general surgery. I liked that there were immediate fixes to problems and that you could profoundly change patients' quality of life. But when I met the urologist, I thought our personalities clicked very well. I also appreciate that urology is such a diverse field. You can have short cases and long cases. You can build long-lasting relationships with patients. You can see them for the most of your practice. And I also liked that when we address issues together, we're addressing a lot of sensitive issues that can make a big difference to their lives. I think meeting everybody in the urology centers of Alabama, it felt like the same collaborative atmosphere that I grew up training in for the last 6 years. I thought the personalities meshed really well. And I also appreciate the vast experience and variety of physicians and how many years they've been practicing. I think that's great for when you're looking for advice on how to take care of patients. And also, if you wanted to do cases together, I appreciate that there's always someone smarter than you in the room, so you can seek help whenever you need it. I love general urology and benign urology, so I look forward to practicing that the most. My main focus will be minimally invasive procedures of benign prostatic hyperplasia, or BPH. I'm excited to bring a procedure into the urology centers of Alabama called the HoLEP, or holmium laser enucleation of the prostate. A HoLEP is a procedure to treat an enlarged prostate. It gets rid of the obstruction caused by an enlarged prostate by laser enucleation. What that means is that you're essentially coring out an orange and leaving behind the peel. So that's what we do for the prostate. It's a size-independent procedure that can help a lot of patients who may not be able to undergo robotic surgery. It's a same-day procedure. Patients get to have an immediate result. They get to be discharged home the same day after undergoing a HoLEP procedure. I think my favorite surgeries are anything to do with the kidney. I do love treating kidney stones. It's very similar to scuba diving, I think, the visual that you get when you treat kidney stones. But I also like that it's an immediate fix, so oftentimes the concerns leading up to it, the pain is very acute, the symptoms are very acute, and then you treat the kidney stone, and afterwards patients feel an immediate difference. I think it's one of the few surgeries they actually feel better after getting operated on, which is rare with surgery. The biggest myth about being a urologist is that it predominantly the field is of male issues and concerns, but that's not actually true. It's 50% of our patients are female. And just like men, they have kidneys and bladders, so a lot of the issues that occur for males also occur for females, and so I love that you can actually take care of both patients, and oftentimes it's my female patients that are the most surprised to see a female urologist, so I think that makes a big difference in the field too. I love collecting vinyl records. I love shopping for old things with my husband. We love old typewriters and things like that. We love to travel, so we just came from India and Bali before moving to Alabama. We traveled there to visit my family and then to take a vacation before we moved here. We love to run together and explore new cities, so I'm very excited to be able to go to a place that's been home to him and explore it, get to know it like I know Cleveland, Ohio, and also get to experience other cities that are nearby, which is very nice. Urology continues to have advancements in technology and techniques, and it makes it very exciting to keep practicing. I think the training for urology can be very rigorous, but the rewarding aspect is actually when you get to spend the time with the patients and you get to explain things, you get to make sure that they understand and can explain it back to you. I think the part that will carry for the rest of my practice is actually building relationships with patients and making sure that they fully understand their concerns and the questions that they have are all answered. I think the time that we spend with them is the most valuable part of the practice, and I think that's what enriches the daily life, clinic life, and even getting to operate in urology. It's really just the patients.